Hi, my name is Christopher Westfall from SeniorSavingsNetwork.org, an independent agent brokerage site where you can shop for Medicare supplement plans with unbiased, independent advice that doesn't cost you anything. Also, we have a website for agents called MedicareAgentTraining.com, where agents can come to learn about the latest and greatest marketing marvels with regard to selling Medicare supplements by phone across the country. What I wanted to point out for you today is a few months ago, we put out an alert to our clients and to our agents about the coming changes with Medicare Advantage plans. Having attended the National Conference on Medicare Supplements in Scottsdale, Arizona this year, as well as 2 other launch parties from major field marketing organizations that sell Medicare Advantage, I reported back to our agents and our clients that the Medicare Advantage marketplace will be drastically changing starting this year for the 2014 plan year. And several news organizations that follow the Medicare Advantage marketplace have recently come out with articles that I just wanted to point out to your attention here. This is from Kaiser Health, and Kaiser Family Foundation is a nonprofit organization out of California. They also have a big health plan. But this article is titled, "Seniors Cautioned to Pay Close Attention to Details as Enrollment Begins in Medicare Plans." And I'm just going to read part of this for you. This is talking specifically about drug plans as well. Among the top 10 most popular drug policies, monthly premiums for 2014 are changing dramatically, up 55% for one AARP health plan and down 38% for another from WellCare, according to a recent study. In addition, the most popular plan, SilverScript, is now off limits to new members until Medicare officials are satisfied the plan's nearly 2.9 million beneficiaries can fill prescriptions without encountering problems. And it goes down to say about the donut hole, and if you've not yet seen the video about the donut hole and how to avoid it that we produced recently, you really need to. But down here, check this out. This open season also will have 142 fewer Medicare Advantage plans, the private plans that are an alternative to traditional Medicare fee-for-service coverage. So 142 fewer Medicare Advantage plans, not people, not counties, but plans entirely. That's a 5.3% decrease in plans available to seniors. So they think that the enrollment's going to continue to increase as more seniors are turning 65, of course. And it says 1 in 4 Medicare beneficiaries have Medicare Advantage coverage. That's a little bit inflated. And officials expect average Medicare Advantage monthly premiums to increase by $1.64 to $32 a month next year, while the average prescription plan premium will remain roughly the same, around $31. So there are a lot less plan offerings available this next year. Look at this. While the AARP Medicare RX Saver Plus, that's a Part D only drug plan, premium will go up 55% next year. It is still below the average national premium. So shopping for the drug plan is going to be very, very important. And I wanted to see this right here. But price hikes, poor performance, and changes in covered drugs are often not enough to spur the vast majority of seniors to action. Only 13% last year changed policies in the last 4 years since Congress added the drug benefit in 2006. So seniors are getting on the plans that they're on and staying with them. Over 85% are staying right where they are, even though that plan may not be in their best interest. Not a good idea. And then for those that are on Medicare Advantage alone, this Avalier analysis reveals first drop in Medicare Advantage offerings since 2011. And it goes on to say Medicare Advantage HMO offerings grow while PPO and private fee-for-service plans, that's the freedom and the choice to go outside the network, are exiting the market. Analysis shows significant variation in Part D drug premiums in 2014, and 5 out of the top 10 prescription drug plans have a double-digit rate increase. And you can see a majority of the counties across the country will see a decrease in the number of Medicare Advantage plans available from 2013 to 2014. Approximately 80% of counties in the South and Midwest will see a reduction in Medicare Advantage plan options, while slightly more than half of the counties in the Northeast and West will have fewer plan options. So Medicare Advantage is not the panacea that it was once promised to be, where you can have all these choices of all these different plans. You can read on to see For 2014, plan sponsors are responding by reducing their footprint in rural markets and relying on more highly managed plan products, such as HMOs. Whenever somebody in the government or insurance tells you they're going to manage you better, what that usually means is they're going to control the cost of managing you better. So it says again, overall HMO offerings will grow while PPO offerings will decline. Local and regional PPOs will decline 16% from 709 plans in 2013 to 591 plans in 2014. So special needs plans, which are plans for those people who are dual eligible, which means Medicaid and Medicare, those plans are decreasing as well as the chronic SNP plans, which are things for people with congestive heart failure maybe, diabetic-only plans. Those plans are declining up to 30% this year, so less opportunities for those people. And then, of course, it talks about the Part D drug plans and how those premiums are increasing. So when you're checking on a Part D drug plan or you're checking on a Medicare Advantage plan, you can't just stay on the same plan that you had before. We at the SeniorSavingsNetwork.org recommend being on a Medicare supplement plan because you can still go to any doctor and any hospital that accepts any form of Medicare payment. That is true freedom and choice. Of course, if you didn't select a Medicare supplement plan when you turned 65 or recently left maybe an employer plan, you have to qualify based on a few health questions. Any time in my life I've found that you have to qualify for something or earn something based on being good enough to qualify, it's usually the better option that people want to get into because of the mere fact that it's not open to everybody. Medicare Advantage plans are open to anybody and everybody simply by signing on the bottom line. Many seniors are lured in by the free premium, zero premium. Well, for many of these plans that have come out recently, the maximum out of pocket on those plans with deductibles, co-payments, co-insurance, and restrictions are now up to $6,700 per calendar year. $6,700 is your maximum you pay before the health plan pays everything. But if you think that those plans are a safe bet, here are two of the number one plan in the country, United Healthcare. Here's a story from the Providence Journal. United Healthcare dropping Rhode Island doctors from Medicare Advantage network. United Healthcare of New England is dropping dozens of doctors from its Medicare Advantage plans, narrowing the choices for thousands of elderly patients in Rhode Island and enraging the doctors who were eliminated. Now get this notification part. United has notified the affected doctors, but so far has not told the patients, who have until only December 7th to re-enroll with United or choose another plan. Patients whose doctors have been cut can choose another doctor, choose another Medicare plan, or just pay for your own doctor out of pocket. Now here's what most seniors don't understand. If you signed up for a Medicare Advantage plan, a managed care plan, you can no longer use your Medicare red, white, and blue card to walk in the doctor's office and have 80% of that bill, any doctor, paid for by Medicare. No, you've subjugated yourself to the rules, restrictions, and policies and co-payments of your Medicare Advantage plan. Now, if you wish to disenroll from your Medicare Advantage plan, you have until February 14th to do that. That's the disenrollment period. Most seniors that we're speaking with that are on a Medicare Advantage plan being affected by situations like this, either having their doctor drop out or the plan leave their county entirely, are choosing to disenroll during this annual election period so that their disenrollment takes effect January 1st. That's the smarter thing to do. But here, some of these patients are not even being notified that their doctors are leaving the network. So if you've not yet communicated with your primary care physician and you're in a Medicare Advantage plan, it would behoove you to do so immediately, to contact your doctor and see if they're still going to be in the same Medicare Advantage plan you've grown accustomed to. I'll continue with the article. United declined to answer questions about how many doctors were being eliminated and by what criteria, except to say that the insurer aims to provide a network of physicians who we can collaborate with to enhance quality, to enhance health plan quality, improve healthcare outcomes, and lastly, but most importantly, and curb the growth in healthcare costs. They're going to manage you. So down here, Larry Grimaldi, spokesman for the State Department of Elderly Affairs, says he believes that, quote, Somewhere around 95 doctors are being removed from the network. He said that United's provider directory already reflects the changes, even though they won't take effect until February 1st, so beneficiaries can check now to see if their doctor's in the network. And that's a big number for a small state like Rhode Island, which is actually smaller than the county that I'm talking to you from right now, Volusia County, Florida. It's a small county, but that's making a big difference. Quote, this decision is unfair and very abrupt, without any well-communicated reasons, said Dr. Waleed Saber, an interventional cardiologist in Woonsocket. Saber said that his 2-physician practice has been cut from United's Medicare network, affecting about 450 patients or 13% of their practice. Quote, this has not happened before. There has never been an incident where a health insurance company dismisses mass numbers of physicians from different specialties with no reason. So it goes on to say here, many are specialists, especially cardiology, dermatology, endocrinology, and ophthalmology. Some doctors who have not yet adopted electronic medical records. They look at your mix of patients, they're dumping patients. These may be expensive patients because they're having to see those people. Dr. Lynn Eiler says, our patients are freaking out, says a dermatologist who's been informing patients that United cut her from the network. Literally, there was a woman shaking. We have very loyal long-term patients, she says. She treats many elderly patients with recurring skin cancers. These patients are likely to switch to Blue Cross, so Blue Cross loses and United wins. Here's another article, completely different. This is from the Tampa Bay Times down in Florida, talking about, the same company. Patients scramble after AARP Medicare Advantage plans drop providers. Citrus County resident George Smith received a disturbing letter this month about his Medicare coverage. The AARP managed care network he had relied on for years will drop all 8 of his and his wife's doctors as of January 1st. Quote, I couldn't believe it. I have my house and car and everything insured with AARP. Oh, how's that working for you? Unbelievable. I thought they are not going to drop me. I've been a member for years. Smith and thousands of Tampa Bay residents are caught up in major changes by United Healthcare, the Minnesota-based insurer that markets Medicare Advantage under the AARP brand, the nonprofit. Patients have received letters telling them to seek new physicians if they want to stay on the plan. Doctors, United won't say how many, have learned that AARP plans will stop paying for their services next year. Now, this is in Florida, so this is happening across the country. The changes affect some of the area's largest providers, including St. Luke's Cataract and Laser Institute, Tampa Eye Institute, and Moffitt Cancer Center. More than 50,000 Tampa Bay residents currently belong to the AARP Medicare plans. United Healthcare is shrinking AARP networks and focusing on doctors, hospitals, and clinics that will enhance health plan quality, improve healthcare outcomes, and curb the growth in healthcare costs. So costs are coming at your expense. That's what the spokesman Jessica Pappas wrote Monday in an emailed response to the Times. Interesting, she sent that same exact response to the Providence Journal. Hospitals and doctors that demonstrate the highest quality and the greatest value always look for the last thing there that they just throw in. The greatest value will be rewarded for their efforts. Pappas could not say how many doctors will be dropped from the network or how many patients are affected. That analysis is ongoing, she wrote. About 19,200 Florida providers will remain in the network. Medicare Advantage plans received a monthly stipend from the federal government to manage members' health needs. The plans create networks of providers that negotiate payment rates. Joining an Advantage plan can be cheaper for patients who remain in network than staying on traditional Medicare, but leaving the network means higher rates. Some jockeying over networks and payments occur every fall during open enrollment period, which ends December 7th. Last year, when United Healthcare and BayCare Health Systems haggled over rates, both sides used advertising. No, they're paid for by the government, and they're using advertising to plead their case to the public before resolving their disputes. Similar spend control has broken out over the AARP changes. Quote, make sure Moffitt is on your plan, read a half-page article in the Tampa Cancer Center from the Tampa Cancer Center in Sunday's Times Bay. Pick the wrong plan and you will pay higher out-of-network costs for Moffitt's world-class care. let me just let you know, if you're in an HMO Medicare Advantage plan and you do go outside the network, there is no coverage for you. Like I said before, Original Medicare will not pay 80% of that bill. You will pay 100% of that bill out of your pocket. United Healthcare had a full-page ad on Monday. There's a shocker. We will continue to offer broad choice in access to care. The ad cited, quote, severe funding reductions for Medicare Advantage plans that have come from Washington, end quote, a theme Pappas recited in her email. This is what we've been telling our members and our agents for the last year. This is what's been developing. If you saw the testimony of the Congressional Budget Office representative before the House Select Committee on Health and Human Services, they talked about the reductions to Medicare Advantage funding that are in the budget, or in this case, the continuing resolution every year that's passed by Congress. The funding is going down. Oh, here it is right here. Actually, the federal government announced this year it is increasing payments to Medicare Advantage plans 3.3% while still pursuing the goal of eventually bringing the cost of Advantage plans down to those original Medicare. That is very, very misleading. They cut the reimbursement and then they gave 3.3% back. Nice spin here. United Healthcare believes that overall funding won't keep up with the growth in healthcare costs. The shrinking network will help AARP plans maintain their current benefits. We regret these decisions will create disruption for some of our members, but they were necessary. Local doctors and AARP patients are responding to the changes by switching their Medicare Advantage plans to stay with their doctors. Patients were panicking at first. We had so many calls and visits. Now they're just mad and saying they are changing plans. George Smith is one. He's already switched to Blue Cross. These are good, prominent doctors. We've been going to them for years. Halls and others said United Healthcare did not even try to negotiate with them a lower rate. They did not come talk to us at all. They just sent a letter saying they were terminating, said Broudhauser, administrator for St. Luke's based in Tarpon Springs. The last time we negotiated rates with them was 2009. AARP Medicare patients made about 12,000 visits last year to St. Luke's, about 10% of its caseload. That's going to impact those doctors greatly. Hauser said he checked the plan's website and noticed other large practices were also dropped. Most of the smaller practices are still in the plan, says Hauser, who hopes United Healthcare will reconsider. Pappas wrote that the insurer decided which doctors to drop based on factors such as, wait for it, such as geography, the size of the doctor's Medicare Advantage caseload, and here it is. Remember, look for the last thing in the quote, okay? The provider's ability to deliver high-quality care for the members in the most cost-efficient manner. Do you want to get the cheapest possible health care cost you can? Well, then go with managed care. Last week, United Healthcare announced it was extending its relationship with AARP through 2020 by lending its name. AARP gets a slice of the proceeds. Wait, I thought AARP was a nonprofit, which helps to lower dues, said special spokesman David Allen. While AARP is aware of these changes, he wrote in a statement, we have no direct influence or control over decisions. So they'll just continue to take the money and the proceeds from using their name, but they don't make any of the decisions. Don't hold them responsible for any of the bad stuff. But the most interesting thing that caught my eye about this article again in the Tampa Bay Times was, I couldn't believe it. I have my house and car and everything insured through AARP, said George Smith, 73 years old. I thought, they are not going to drop me. I've been a member for years. So I just want to reassure you that things are changing, and they're trying to cut costs on the back of seniors even more. If you're not familiar, the Affordable Care Act, otherwise known as Obamacare, effectively cut $700 billion over the next 10 years out of the Medicare budget. Most of that had to do with Medicare Advantage funding, so that other people can have subsidies that are under 65 years old if they can't afford or need help paying for health insurance that they now must have. So just wanted to bring you up to date. If you need some help finding a Medicare supplement plan, again, where you can go to any doctor, any hospital, and if your doctor says it's a Medicare approved claim because it's medically necessary, that bill gets paid at 100%. You can go to any doctor, any hospital throughout the country, even coverage if you go outside the country. Excess charges, if they're billed, are paid for at 100%, and you've got the freedom to travel the country without worrying about restrictive networks or what procedure or test may or may not be covered. You need to talk to us about a Medicare supplement plan. Our number is 800-729-9590. My name's Chris Westfall. Have a great day. Bye-bye.